Hello, everyone. I'm Dr. Mary Clifton. I'm an internal medicine doctor with 25 years experience, and I'm the developer of CBDandCannabisInfo.com. That's a free website with about 100 researched, referenced, peer-reviewed educational videos that are available for you and your patients and clients so that you can learn how to choose and use cannabis for various educational for various disease states. In addition to that, I've created the Cannabinoid Protocol, which is a certification program designed for practitioners and people who work in dispensaries and personal coaches so that you can get the support that you need, the educational background you need to feel confident and legitimized within the cannabis community. I'm so delighted by the most recent election results in all of the places where cannabis was brought forth in any kind of vote. It was moved forward. So there's a decreased risk of excessive legal confrontations when you have a cannabis exposure. There are more and more people across the country who are going to have good, safe access to these very high quality medicinals. But we are only as strong as our weakest link. So even though it's great news and everything is moving forward beautifully, I think that we need to continue to keep the pedal to the metal and make sure that we work not only nationally, but also internationally to drive the cannabis industry and drive these tools so that every patient can get the care that they need. My personal belief is that it's the education that's going to drive the entire process forward. So I am extremely grateful that you're here and that you're thinking, that you're innovative and dynamic and resourceful, and that you're ready to move this process forward in your area and beyond. This is very valuable work that you're doing, and I'm delighted to be asked to share my work with you. I'm going to go ahead and share my screen so that we can work together on the materials that I developed. Usually when I talk in this video in Stopping the Top Killers, I start with heart disease. I start at 5 at stroke, and we go back through all of the other conditions that lead to people dying or having or getting close to dying, having terrible outcomes at the end of life, and talk about how cannabis and other cannabinoid formulations can help to reduce symptoms and also to reduce the risk of these conditions. Because we have this limited time frame today, we have 25 minutes, I'm going to focus just on accidents and cancer and heart disease with you. And then at any point, if you want to circle back and see all of the video, you can check it out. It's posted on YouTube, or the Cannabinoid Protocol, my education program, has all of this broken up into wonderful little bits in the metabolism section. So we'll start with accidents, we'll talk about cancer, and then we'll finish on heart disease, which really all of those are great. Because we have this limited time frame today, we have 25 minutes, I'm going to focus just on accidents and cancer and heart disease with you. And then at any point, if you want to circle back and see all of the video, you can check it out. It's posted on YouTube, or the Cannabinoid Protocol, my education program, has all of this broken up into wonderful little bits in the metabolism section. So we'll start with accidents, we'll talk about cancer, and then we'll finish on heart disease, which really all of those are great topics. Accidents and mortality, I think the biggest takeaway here is that we don't think about accidents as being anything other than a motor vehicle accident. And we focus so much on cannabis and its effect on motor vehicle accidents and experience and the capacities of the driver who uses cannabis regularly. But I also would want you to think about other ways that people have accidental deaths, including drug overdose and poisoning, which actually, exceeds the number of deaths from motor vehicle accident each year. You would have to be living under a rock to not be thinking in the United States and about the US opioid epidemic and the crisis that we find ourselves in with the diversion of these opioid medications. So thinking about drug overdose and poisoning will also be an important part of thinking about how cannabis can be used to potentially reverse or reduce risk of accidents and mortality. But let's start with motor vehicle accidents. When you're studying motor vehicle accidents and studying people's, uh, 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 management of a car and how well they're driving, we study this by assessing response time and lane weave, how quickly you can hit the brake, and how quickly you can, or how much you're overcorrecting or undercorrecting between the line in the middle of the road and the line on the outside of the road. So in terms of both response time and lane weave, if you use both alcohol and cannabis in combination, you can see adverse effects in both of those places. You can also see adverse effects with other medications like sedating antidepressants and painkillers and benzodiazepines. Interestingly, you don't see the same effect in somebody who has been using sedating antidepressants or using a cannabinoid formulation after more than 2 weeks. So for people who are regularly consuming these substances, you're not going to see a significant difference in these particular measurements. In order to get a difference in driving for cannabis users, you actually have to couple it with alcohol use, and that's where you can see the differences in a person's response to driving or to driving while under the influence. There's a similar tolerance with other medications and formulations. So it's important when you're working with your patients to be, thinking about the effects of any sedating therapy on their driving or on their operating of heavy equipment. Um, and interestingly, for patients who have ADHD, when the ADHD is treated with a stimulant, it actually leads to improved driving skills. And of course, this may be part of the reason why cannabis may, in some cases, actually improve driving skills. In one study that has been following people who have used cannabis formulations for many years, this drug company has accumulated 55,000 patient years of driving while under the influence of cannabinoid formulations. They've actually seen no change in driving ability. There's been no increase in accidents. There's not even been an increase in parking tickets. And part of the reason might be that a lot of people who are using the cannabinoid formulations are using them to treat chronic conditions like multiple sclerosis, conditions that could lead to some cognitive effects, some difficulty concentrating, or could lead to some muscle spasticity. And when that spasticity or the cognitive effects are controlled by the administration of a cannabinoid formulation, it may actually improve their driving capacity rather than deteriorate it. So in this particular study, which I think is a profoundly valuable study of patients who have been using cannabinoid formulations, a cumulative review of 55,000 patient years identified that there was no deterioration in driving capabilities and really no significant risk to the chronic user that they're going to experience a higher rate of motor vehicle accidents. Now, it's important to note right at the bottom of this slide that US and other countries, there is a zero tolerance for driving while under the influence. And we have to strongly encourage our patients not to drive while under the influence. But chronic use of therapies does not appear to lead to any significant negative outcomes for the driver. And this is just a longer review of this particular study published in 2015, in January of 2015, reviewing all of these patients who were fit or unfit to drive. And Actually, this is a different study. This is a second study that was conducted on 33 multiple sclerosis patients, and they underwent driving tests to look at how they drove at baseline and how they drove at final visits. And it was found that treating MS patients didn't negatively impact their driving ability, but actually, again, as the previous study showed, by improving muscle spasticity, it may improve their overall driving experience and their capabilities. One of my most profound accidents was with a patient who was in the passenger seat when they were T-boned, when her husband with Parkinson's disease sort of wasn't able to respond quickly enough to a car that was rushing at them. And it was the Parkinson's that was slowing down his response time and actually led to them having a very terrible outcome that involved her being in a halo for upwards of 3 months to manage a neck fracture uh, that was poorly healing. It was really, really brought the message home that if a driver does have some spasticity or some limitations to their motor function, you may see this increase in response time to disease. And controlling the disease will certainly make them a safer driver on the road. So there's the driving accidents that we may be able to assist, but we certainly aren't going to hurt with cannabis. But the other thing that we think that cannabis can do from the point of view of helping with activities is by decreasing alcohol consumption. And of course, there's a clear link between using alcohol and having motor vehicle accidents. So decreasing alcohol consumption works very well to help reduce risk of accidents in states that have done this. We find that there is not only a decrease in sales of beer and a reduced total alcohol consumption, but a decrease in alcohol-related traffic fatalities as well when cannabis is legalized in a particular state. And in addition, there's the opioid crisis. Nearly 1/3 of New York opioid deaths involve prescription opioids. So there's, of course, the black tar heroin issue that is coming from Central America and from a particular location in Mexico. But there's also all of the opioids that are being diverted from a pain suffering patient into a broader population. Now, cannabis turns out to be a remarkably effective product for managing chronic pain. According to the Clinical Journal of Pain, published in 2016, this was a very powerful study, a 6-month study that involved 206 Israeli patients with pain for 3 months or longer. The pain was uncontrolled on at least 2 pain meds prescribed at maximum dose. So the 206 study patients were in pain for at least 3 months and were on 2 medications at maximum dose without achieving adequate control of their pain. These patients were treated with either cannabinoid cigarettes or cookies, and their products were titrated to 3 administrations a day. Their pain severity, pain interference in their life, and their social and emotional scores all improved by treating with a cannabinoid formulation. Opioid use in this group decreased by 44%. And 32 patients had entirely discontinued their opioid treatment at follow-up. So a very remarkable result in this group where pain management was achieved and achieved very effectively with cannabinoids. And of course, without the risks to heart or lung function. I mean, we know that the endocannabinoid system is laid over the entire body. There are CB receptors on every organ in the body, but there aren't any CB receptors in the brainstem. So in this very primitive part of your brain where the breathing and the heartbeat is controlled. So you are not going to experience a reduction in your heart rate, a stopping of your heart, or a reduction in your breathing, a stopping of breathing with using cannabinoid formulations. They work in a very similar way to opioids in that they work at the same receptor sites, but opioids work on the mu receptors and the cannabinoids work on the CB receptors. There's also a difference in the amount of addiction potential between the two agents. So it really does seem like in the future, we'll be seeing less opioids and more cannabinoids to manage pain and further reduce risk of accidental overdose and death. In terms of also stopping the top killers, we have to think about cancer, which is the number 2 killer here in the United States. The risk of dying from cancer is 22% for men, almost 19% for women. We're gaining on them. We're shattering that glass ceiling. The most common cancer being breast cancer, with over 271,000 new cases expected annually. The new cases of cancer diagnoses are growing by 50% per year because we're catching it earlier and identifying it faster in a lot of cases, particularly with regular screening colonoscopy, with good skin examinations, good dermatologic examinations. The most common cancers are lung, prostate, and colorectal cancers, but the laryngeal cancer and lung cancers have the worst survival rates. And just as an interesting aside, Kentucky has the highest cancer rate in the country. Only 30% of oncologists feel that they can make an informed decision about cancer. When we've studied doctors, upwards of 78% of doctors think that cannabinoid formulations, CBD and cannabis, have a value in managing conditions, particularly end-of-life conditions, symptoms of end-of-life, like air hunger, pain, and anxiety, and poor sleep. But only 30% of doctors feel that they can even recommend it because it's not in the ordinary pattern of recommendations. It falls out of what would be considered usual treatment for most of these conditions. But there are potential anti-tumor activity in the plant-derived phytocannabinoids. Both THC, CBN, CBD, and CBL, as well as some synthetic cannabinoids, have become the focus of current research to try to figure out exactly how they work against cancer and which particular cannabinoid is the most effective. Many cancer cells become resistant to anti-cancer therapies because the PGP pumps the drug out of the cells. PGP pumps are like little antitoxin pumps on the cell wall, and they work to pump the any toxins that the cell is being exposed to out of the cell, which is a great thing in general. But if you're trying to treat cells with cancer chemotherapy, you want that chemotherapy to get into the cells and stay there. And it appears that cannabinoids can help when combined with chemotherapy to slow the PG pump recognition, their recognition of the cancer chemotherapy agent as a toxin, and then help to reduce the effect of that pump for pumping the agent out of the cells as quickly. So that could lead to an increased efficacy for anti-cancer agents. And that may be where cannabinoids work their best, is when they're provided sort of in tandem with cancer chemotherapies. They may also work to stimulate the immune system to cure cancer. There's these things called security checkpoints where T cells, these important cells in the immune system, can detect normal or abnormal cells as part of their scanning system. The interaction between the PD-1 and PD-L1 is involved in attenuating infectious responses, but you can also harvest the immune system to enhance the body's response to certain types of cancer, and also delay tumor growth and facilitate tumor rejection. The overall anti-cancer effects can also be seen with MAPK ceramides. The MAPK and ceramides, sorry. MAPK is a mitogen-activated protein kinase. This is a signaling pathway that works within the cells to help cells recognize when they need to grow, when they need to divide, but also importantly, when they need to die. Every cell has to go through a normal life process. And in some cases, the normal life process gets attenuated in cancer cells. They think that they're immortal. And then they work to bring a lot of blood flow to them and attract a lot of energy away from the body and to the cancer so that they can grow very quickly and create a whole group of immortal cells. So the cannabinoids seem to be effective at working through the MAPK and also the ceramides to help cancer cells see that they are moving through a normal life process and that it's time to move into cellular apoptosis and eventually cell death and just go ahead and pass away. So this stimulation, the overall anti-cancer effect through MAPK and ceramides, and also through the ROS system, are providing that the TIMP, the ROS-TIMP pathway, are all working to help cancer cells move through a more normal pattern of life and death. And so in each of these situations, it's helping work together to help the cell recognize that it needs to die, which is a very valuable thing for cancer cells. The MAPK, ceramides, ROS, and TIMP are all different mechanisms that are sort of doing the same thing. But it's wonderful when we can identify a product that works through different mechanisms, because oftentimes, if it doesn't cover all kinds of different mechanisms, then the body will find a way to, sort of get around, or the cancer will find a way to get around one particular thing and continue to grow effectively. So having a product that sort of works from a number of different mechanisms makes it a little bit harder for the cancer cell to ignore it and continue to be able to grow unchecked. The ROS is the reactive oxygen species, which is, the oxygen radicals that are produced in the mitochondria after the production of energy from oxygen. This production of CO2 can also be, and reactive oxygen species can also be harnessed to help promote cell death. CBD is found to regulate reactive oxygen species pathways through interleukin 1. And TIMP, the tissue inhibitor of matrix metalloproteinase 1, is a calcium-dependent, zinc-containing endopeptidase, again, inhibiting cell invasion. This is important because as cancer cells grow, they need to get in and around other cells so that they can grow into those spaces. And so having a cell that can proliferate and migrate and attract blood flow to it is a very important part of cancer cells growing. So cannabinoids working in the TIMP is very favorable to help reduce cancer growth. Now recognize that all of these things are happening in test tubes. This is not proven in a human model. It's not even proven in an animal model. You're talking about things that are very, very early in the course of understanding and getting the tools around them that we need to know for sure that they're going to work in humans. But we have found in small studies that there may be ways to enhance chemotherapy with a combination of cannabinoids. It's found in a mouse cancer model that you see improvements in brain cancer when cannabinoids are combined with radiation therapy. And in a small study of gastric carcinomas, anandamide enhanced the cell death effect of paclitaxel. When administered with the chemotherapy agent gemcitabine, there was a synergistic inhibition of the pancreatic adenocarcinoma cell growth, which was shown by reactive oxygen species-mediated cell death. And in certain leukemia cell lines, you also saw a stronger response to chemotherapy when cannabinoids were in place. We think that smoking or orally administered cannabinoids are certainly effective in reducing chemotherapy-induced nausea and vomiting, as effective as the current therapies on the market, and plenty of randomized controlled trials at this point supporting that. And this just again says that there is really not enough data to advise your patients to forego conventional therapy in favor of using a high potency cannabis extract. We still need to make sure that we're using appropriate therapies and protecting our cancer patients. I have got minutes. I'm going to plow through metabolism and heart disease. But heart disease is huge. About 610,000 people die of heart disease in the US each year, and virtually everyone you know has some sort of metabolic condition like cholesterol or hypertension or diabetes or overweight syndrome. 1 in 4 people will die of heart disease. It's the leading cause of death for both men and women. And look at this heart disease chart, just clustered so aggressively in the Midwest and southern states. Very important that we figure out how to reverse heart disease risks for our country and help our people live longer, healthier lives. There are all kinds of reviews and patient case studies that present a patient who died after using cannabis. It appears that there are some people who, in truth, when they are predisposed to having heart disease and they have an exposure to cannabis, it can cause them to have some sort of acute process. It might be a coagulation thing. It might be a slight elevation in heart rate. If there's a stimulatory cannabis use, that leads to acute coronary syndrome. This is the story of a 63-year-old non-tobacco smoking man who presented to the ER with ST segment elevation, MI, STEMI, and chest pain after smoking cannabis. And here's another young man with normal coronary arteries. He is a cigarette smoker. He was also athletic, but the episode of ST elevation MI after participating in the sport was blamed on the cannabis. And there is a path here that starts to suggest that a lot of people, once they hear cannabis, they really like latch onto that, and that becomes the reason for the patient to have undergone all of the issues that they were dealing with. So having I think that there may be in some of these cardiac reports a little bit of bias, and in fact in this particular review published in marijuana use in cardiovascular disease, shows that longitudinal studies have indicated that marijuana use may not have a significant long-term effect on mortality. And even though there are these old documents that show negative responses in a lot of different situations, there's also a lot of positive responses that can be seen with the use of cannabinoids and in the metabolism. For example, in patients who are experiencing a heart failure, one of the key negative outcomes of experiencing heart failure would be the development of dysrhythmias and particularly atrial fibrillation. Cannabis users who experienced heart failure are less likely to have atrial fibrillation than non-cannabis using heart failure patients. The onset of atrial fibrillation after a bout of heart failure extends the hospital stay and increases the morbidity and mortality for the patient. So this reduction in irregular heartbeat in heart failure patients is in fact a very interesting outcome. And presenting at Heart Rhythm 2018, the first ever in-human study of more than 1 million patients looked at the arrhythmic effects of marijuana after a heart attack and found that non-dependent cannabis users were 18% less likely, and dependent users 31% less likely to experience atrial fibrillation after their heart attack. So again, really great outcomes for people and this is a very important thing to really optimize patient care to avoid these atrial fibrillation episodes after a heart attack. So the researchers said, we still don't know the true long-term impact on one's health, but at this point, a negative connection is not seen. Um, and I just am stating that again in a few other places. But just to quickly review, cannabis may also reduce high blood pressure, atherosclerosis, and inflammation, which can improve these conditions of cardiometabolic risk factors, things that increase the risk of heart disease, such as elevated BMI, elevated waist to hip ratio, HDL and LDL cholesterol, triglycerides, glucose, elevated glucose or insulin resistance, and blood pressure issues all are seen to be better when you're regularly using cannabis. And this may be simply because people who use cannabis keep a lower BMI over their lifetime. Studies have shown that. But it may not just be that regular cannabis users are overall thinner than non-cannabis users. It is likely that there is some additional metabolic modifications that occur directly because of the cannabis on insulin receptors and on the cell's receptivity to insulin, and to a number of other things that continue to be studied. In terms of decreasing progression of atherosclerosis by impacting the inflammatory pathways, and also reducing that insulin resistance. We have a lot to cover. It's a lot in a very short time. So I'm just going to scooch through here, but I wanted to show you this map of legal cannabis. Thank you, Rolling Stone magazine. Next to and this is dated actually, it probably looks a lot greener now, but also next to the heart disease death rate map that I showed you earlier. You can do this same comparison between heart disease and cannabis, or opioid deaths and cannabis. It's very powerful when cannabis is legalized, what it is able to do to help control the health of your community. And what you're doing in the Nurses Association working in cannabis is also working to restore the health in your community. You have my gratitude for everything that you're doing, for the innovative, disruptive way that you are working. And if you ever need anything, you can reach out to me anytime.